All right, vertebral column, part 2. I'm going to reiterate points that I talked about in our first lecture about the features of a typical vertebrae. Okay, so remember, the typical vertebrae begin with C3, so C3 through C7, include all of the 12 thoracic vertebrae, and then end with lumbar 5. So we're going to talk about the typical features, and then we'll identify some of the atypical features of each region and individual vertebrae. Okay, so this is typical features of a vertebrae. So this wedge-shaped, point with my pencil, this is the body. The body of a vertebrae is the anterior portion, and then you get to the back of the body, and that begins the neural arch. If I show you from above, so everything posterior, here's the pedicle, and this vertebrae, you're looking at the superior surface. This is a lumbar vertebrae, and so here's the superior articular process on the right, the superior articular process on the left, again pedicle, articular process, right, superior, transverse process, and then here, lamina. So this area right here is the lamina, okay, lamina. Okay, lamina. The two lamina unite to form the spinous process. So if my forearms are each lamina, my hands become the spinous process. There you see the vertebral foramen where my head is. Okay? So again, lamina, spinous process, vertebral foramen, and you can see it's not a perfect circle. When somebody has back surgery, a common procedure is called a laminectomy. So they actually remove, ectomy, surgical removal. It's usually to create a little bit more space in the vertebral foramen. Now if we look at the inferior surface, so I'm going to turn this around. Again, here's the body, pedicle, transverse process, lamina. Okay, but here we see the two inferior articular processes on either side of the spinous process. So again, when we look at this vertebrae from the side, here's your inferior articular processes on either side of the spinous process. And if we were putting this in anatomical position, okay, anatomical position, right, left, because the body sit anterior. Okay. So here are those inferior articular processes, right, left. Now this is a real vertebrae. So you can see it's kind of irregularly shaped because that's what happens when you get older. Now you can see this notch on either side, vertebral notch. And if we put a vertebrae below, it would form a circle. Those are the intervertebral foramen. And that's where our spinal nerve roots come out. So one each side. Okay? So if we grab my trusty skeleton and we look at two vertebrae, adjacent vertebrae, you can see the intervertebral foramen formed half from the vertebrae below, half from the vertebrae above, and out comes the spinal nerve on the right side. Okay? So you can look at that all the way. Here's your brachial plexus. Okay? So here you have nerve roots coming out from each vertebral level, and those are what become those peripheral nerves that we've been studying. Now the last point I want to talk about, again, we're talking about the typical features of a vertebrae. We separated the vertebrae, a body, and then everything posterior to the body is the neural arch. I want to talk about these facet joints. Now I got a thoracic vertebrae with another thoracic vertebrae, and I want you to see how they might articulate. Let's see, these two go together that well. Here we go. Okay? So if you look at the superior vertebrae, the inferior articular process is going to articulate with the superior articular processes from the inferior vertebrae. It's a whole lot of superior and inferior. Now you can see those facet joints. Okay, these are not exactly in order. That's why the intervertebral foramen isn't perfect, but you can see the facet joint. The facet joints in the thoracic spine are oriented in the frontal plane. So what that means, like this, okay? Okay, frontal plane. So you can see that. You see how these articular processes are located in the frontal plane? And so are these articular processes are in the frontal plane. So when they come along and articulate with one another, you can see frontal plane. Okay? In the thoracic spine, the facet joints like side bending because they're oriented in the frontal plane. The articular processes in the lumbar spine are oriented more in the sagittal plane. So you can see sagittal plane. I'll show you that on the skeleton. And in the cervical spine, here's my cervical vertebrae, the articular processes are more on a diagonal. So you can see the articular processes. Superior, inferior. Okay? So that's the typical features of a vertebrae.